Greetings of the day, everyone. I am privileged to welcome you all to another episode of our Health Talk series organized by the Student Council of Sadabai Raisoni Women's College, supported by SGR Foundation and powered by Raisoni Group of Institutions. In the 21st century, cancer awareness has become extremely important. Despite major breakthroughs in cancer understanding, diagnosis, and treatment, factors that should contribute to the disease's decline, the number of cancer cases identified each year has continued to rise around the world. However, according to the World Health Organization, up to 40% of cancer related fatalities can be avoided. As a result, boosting cancer prevention awareness has become a top priority for many cancer and health organizations around the world. Today, I am joined by Dr. Preetam Jain, a super specialist in medical oncology and hematology. His expertise extends to not just chemotherapy and targeted immunotherapy, but also in treating blood cancers. Further, he has also achieved major success in treating cancers in women. He has been affiliated to some of the best hospitals in the state, including Breach Candy Hospital, SL Raheja Fortis Hospital, Wockhardt Hospital, and Saifi Hospital, to name a few. And he also holds memberships across several medical associations, including both the European Society of Medical Oncology and the American Society of Clinical Oncology and the Medical Council of India. Sir, a very warm welcome to you. Thank you so much for your time today, and I really look forward to having a fruitful session with you. I'd like to hand over the session for you for a brief introduction and for a short presentation on cancer.
Thank you so much for your kind introduction. First of all, at the outset, I would like to express my thankfulness, and it's been a great pleasure to be associated with all of you. Good to see all the youngsters taking interest and participating in cancer awareness program. Indeed, it's a noble job to be a part of this session. So I've been told to briefly describe about what is cancer and what exactly is a real scenario of the cancer existing in our country. Followed by, I will be taking up your questions one by one, and I will try my best to answer all your questions. So let's try to understand the whole scenario of this life-threatening disease, what we call it as cancer, right? Please allow me to share my presentation.
Yes, please.
Okay, that's great. So, if you understand the tagline that is written over here is know your risk. I can survive. What exactly this means? It's not just like I can survive. What it means that you have to break the cancer with these two lines. When you break this cancer, you will survive. That's what it means. So try to break the cancer with your positive attitude and dedication towards the cancer treatment. Then only you can survive. And that's the understanding of this particular tagline. So I'm Dr. Preetam Jain, and I'm a medical oncologist from Mumbai. I'm going to speak few important aspects of cancer, its incidence, and what is the real world scenario as of now. So World Cancer Day, we all celebrate this World Cancer Day every year. And every year there are different captions that they focus on this. And the recent caption that they have declared is I am and I will. What it means that I'm going to fight it and I will continue to fight. Is nearly 7 lakh people lost their life to cancer. Early detection of cancer. That's of paramount importance. Very important is don't be afraid to get yourself checked. So the World Cancer Day is celebrated on Feb 4th. If you see in the world that 17 people die every minute from cancer, and usually the theme keeps changing. And one of the important themes that is still existing is I am and I will. Presents the power of individual action taken now to impact. Which is celebrated on 4th February. The most important is I can and I will. What happened? I'm sorry. Yeah. Is my slide visible?
Are you still on your first slide, sir? Or have you moved on?
No, I'm on the
Because
fourth slide.
okay, so I believe it
I'm on
has
the fourth
something.
slide.
Okay, I believe it has something to do with network issues then, but you may carry on, please. You can carry on if the fourth slide is on yours.
Huh. So we can prevent and detect early and treat the cancer successfully. The whole theme is I can and we can. See, 1 out of 10 cancers may be linked to diet, the bright. There are many cancer is not curable, and cancer is always cancer is infectious, and cancer is hereditary. Cancer is cancer, and no cause is discovered. Early detection is not possible, and biopsy worsens the cancer. Radiotherapy and chemotherapy causes a lot of side effects. So these are the myths that is commonly prevailing over here in our society, and it's important that you understand the myths and try to clear these myths before you actually go ahead with your treatment.
Hmm.
So let's just understand what causes cancer, what is cancer, what is the link between genes and the cancer, how is cancer diagnosed, and can cancer be prevented? You see, early cancers may not have any symptoms, so it's important that you get yourself tested to get yourself detected. Lifestyle is an important factor of cancer and is associated with the origin of your cancers also. Proportion of global NCD deaths by the cause of death is, if you see, cancer stands second most commonest cause of death among the world. So it's important that you reduce the mortality so that the fear that is there among the society, they have this power to fight against this cancer. This is a major public health problem right now in the world. If you see, 7.6 million people worldwide have died from cancer in 2008, and 70% of cancer deaths are occurring in the lower and the middle income countries. 30% of these cancers could be prevented. So, quick cancer facts. You see, the main types of cancer leading to overall cancer related mortality are lung, stomach, liver, colon, and breast. So, these are the five important cancer related mortality. So, the quick cancer facts, if you all see, 30% of the cancer deaths due to the five leading risk factors are secondary because of the high body mass index, low fruits and vegetables, lack of physical activity, tobacco use, alcohol use. These constitutes approximately 30% reasons for the cancers. Tobacco use 22% of the global cancer deaths, 70% of the global lung cancer deaths. If you see, most of the lung cancer patients, they all are, consuming this tobacco pretty heavily, either in the form of oral or smoking. Cancer causing viral infections like HPV, HCV, and HPV. These are viral infections which are
Hmm.
seen in lower and the middle income countries. So the Globocon data in India, if you see, among the female, the highest number of cancers what we see is the breast, followed by cervix, then colon and ovary. In males, we have lung being the most commonest cause, followed by head and neck, stomach, and colorectal. And
Okay.
these are the most important cancers that we see across both males and females in our country. The five most frequent cancers in India ranking defined by the total number of cases. If you see in the males, it's the lip and the oral cavity, which is commonly called as head and neck. Commonest cause for head and neck is consumption of tobacco inside the mouth. That's ranked number one in India. Then we have lungs, then we have stomach, colon, and the pharynx. Pharynx is the again a part of your head and neck. Among the females, it is the breast. That's the most common cause of cancer that is seen in the breast, followed by cervix, and then colorectum, and then ovary, and once again head and neck. If we consider both the genders, breast is the most common cancers among the in our country, followed by cervix, then head and neck, then lung, and then colorectum.
Yeah. Yeah.
So the geographical distribution patterns of high and low mortality may reflect exposure to varying levels of particular carcinogens. Your culturals, your dietary habits, your occupational and environmental reasons are of paramount importance. This might illustrate regionalization for racial reasons, a specific genetic predisposition, and resistance to particular cancers. Cancer is curable. What is important is that it is diagnosed at the right time and right treatment is taken. This is the head and neck cancer. If it is diagnosed in the early stage, it is curable. But if you come in an advanced stage, then it's not curable. That's the problem in cancer. So early diagnosis of paramount importance. Colorectal and breast cancers, if you see, the in India, the incidence of breast cancers is less than in America. But the problem in our country is the mortality is higher in our country than in America. So it's important that we save the life of this woman, especially from breast cancer perspective. A lot of patients, a lot of people have migrated from Western to our countries. Depending upon the region, the different types of cancers are seen in different regions. If you see, if you go to the south in Tamil Nadu and Andhra Pradesh, stomach cancers are more common. If you go to the northeast, liver cancers are more common. If you go to the Uttar Pradesh and Bihar side, gallbladder cancers are far more common. Then in the Kashmir side, the esophagus are more common cancers. Almost 2,200 deaths every day and one death every second. The reason for this is tobacco. If you stop tobacco, if you completely prevent yourself in consuming tobacco, 30 to 50% of the cancers can be prevented easily. I'm sorry. So, if a person who's consuming this tobacco in men, your risk of having cancer is this much. But the same thing for certain reasons, if a woman is consuming tobacco, the risk of having cancer is much higher than in a man. That's the problem. So, women consuming tobacco, what they have found that they are at a very, very high risk of having cancers than even men. However, overall, tobacco is hazardous to the health. And what they have found is that women are more susceptible to cancer substances, maybe more than 2,000, 4,000 cancer substances are present in this. And you are risking your life by consuming this particular tobacco consumption products. Just to make you understand, these are the common sights that you see on the roads, right? Pan Parag, Gutka, Manikchan, Vimal, Guitar, and these kind of shops which is easily visible. Death is waiting for you and your habits are not changing. So I believe it's important that you completely stop this tobacco consumption to make yourself cancer free. Gutka industry is growing from zero to $500 million in 15 to 20 years. This is one of the highest growing industry, and they're giving you nothing but only opening the death sentence. Women smoking is widely prevalent and increasing day by day. As I've already told, tobacco consumption and smoking in women, the risk is more of having cancers than in men. Lifestyle is important. It's been quite common in all the college and the youngsters, teenagers, they believe it's pretty cool and they see one person smoking and the other person also try to acquire the same habits. Both active and passive smoking is dangerous for their health. And those who acquire these habits right from a younger age, they get addicted and it's becoming difficult for them to get rid of this particular cancers. Commonly heard scenarios, Mumbai college students smoke to look cool and to relieve the stress. It's actually not cool basically. So this is the cigarette. These are the tobacco products which has been banned. You see in the cigarette, we have nicotine, ammonia. This ammonia is used in your paints. The nicotine is used in fuel. Toluene is used, carbon monoxide, methanol, arsenic poison. This arsenic poison is used to kill the rats. So all these poisons are there in this particular cigarette. when you're consuming the cigarette, these chemical substances are going into your body and they are causing the DNA damage, as a result of which you are prone for cancers. So come on in, be my mouth freshener. I love young blood. That's what the Gudka says. A lot of youngsters at a very early age, they're consuming a very carcinogenic tobacco and they just keep it in their mouth a whole day. In a span of quickly 1 and 2 years, they end up with having cancers. So it's important that the youngsters don't get trapped into all these things and they should be educated at the right time. So mouth cancers 50 times more likely to die from the cancer of the mouth. Throat cancers, 10 times more likely to die from the cancer of throat. These are the different types of head and neck cancers due to the tobacco consumption. This is the lung cancer, 12 times more likely to die from lung cancers. If you're smoking, you're prone for lung cancers. So these are the different scenarios that we come across. The whole idea of presenting today is to make you aware that look, 30 to 50% of the cancer can simply be prevented by stopping this tobacco and all kind of bad habits. So with this, I think this should make you aware. Now, this is another license to kill. Clearly, it is written on all the cigarettes. Yet, you are happily buying the cigarettes, paying them, and opening the cause of death for your own life. So, cancer has become an epidemic. These are the reasons for this. And I believe the right message is to be conveyed at the right time. And I'm sure that with this, at least if any one of you who's watching me, if you have the habit of smoking or consuming tobacco, at least this is the best time that you stop smoking, stop tobacco, get your habits right. Later on, it is only going to benefit you on a long term. So I think with this, I would like to conclude my session and I hand over uh, to the presenters and the host. If you can
Yes, sir.
ask me any questions, I'm happy to take up your questions right now.
Yes, sir. Could you please unshare your screen first? Could you stop sharing your screen?
Sure.
All right, sir. So, firstly, I just want to ask you a couple of questions from, the few points that you highlighted in your presentation. Firstly, you said that you depicted a few examples of gutka, tobacco, and, the many ways they're packaged and sold. But we also see public figures and celebrities endorsing these very products, um, the Bolo Zuban Kesari and the Viman Pan Masala. So, do you think this is inspiring youth to actually go and consume this in more numbers, in large numbers?
Obviously, because it is inspiring, that's why they are, hiring these celebrities. Because what is happening
Hmm.
is that a lot of people try to mimic or follow what the celebrities do. It is just that
Hmm.
because of that reason, smartly and intelligently, the companies pays to these all celebrity peoples to make sure that
Hmm.
they represent these advertisements heroes and ultimately no they create an impact in the memory of these youngsters who are following because they are celebrities and as a result of which this has become quite cool and standard to follow what they are saying. But I have
Hmm.
also seen if any of the celebrities endorsing these kind of a product, there have been a severe backlash from the general public
Yes.
reactions also.
Yes.
Nevertheless,
Yes.
ideally, they should not do this because they represent the public figure and it is their moral and social responsibility that they do not endorse such products just for the sake of money. Because at the end of
Hmm.
the day, it is a tobacco product industry that is growing, but this is it is
Hmm.
growing by killing the people.
Yes, that's true. Okay, sir, and one more question. So you described that certain regions of the country you would find sort of prevalence of a particular type of cancer. Like you said, in Kashmir, there's a prevalence of esophageal cancers, in the north, liver cancers, if I'm not wrong. So why is that? Why is it that certain cancers are more the incidence of certain cancers is higher in certain regions, whereas in other regions you would see some other cancer being more prevalent.
Yeah,
Any
so
particular reason?
I mean, there is no exact specific reason. It is a geographical variations of the cancers that we come across.
Hmm.
Maybe their lifestyle, the weather, and the habits that they acquire, in their own geographical areas. And also,
Hmm.
some of the cancers are running since since ages, and it is being transmitted hereditary in those particular geographical areas. For example, in Kashmir, if they have a kangaroo cancer, what they are doing is because of the cold weather, they are using certain hot substances which is very kept close into their body, and that hot substances are releasing certain chemicals which is leading to cancers of the abdomen, which is commonly called as kangaroo cancers. But the same habit you don't see somewhere in north or the western part of our country, right? So that is one climatic conditions based on which their habits changes. So based on their habits, their diet also changes. So a lot of different diets, a lot of high fatty diet, maybe a high calorie diet, a non-veg with a lot of meat and all these things, and a lot of spicy stuff that is being eaten in a particular areas, they are prone for the gastrointestinal tract. So yes, geographical variations has been a part of this cancer distribution, not just in our country but across the world also.
Okay. So, sir, I also believe you've been a co-investigator in clinical trials. So, I want to ask you, what is usually the focus of cancer-related research?
See, the focus of cancer um, is different in different countries, right from screening, prevention to recent advances in the form of a treatment of cancers. If you see the recent advances in the clinical trials, our main focus is how we can have more therapeutic armamentarium in our treatment aspects so that we can give more options to our patients when they're having cancers. As a result of which, beautiful new drugs have been discovered, which are called as targeted therapies, immunotherapies, precision therapies, or molecular therapies. These treatments have actually, changed the whole therapeutic perspective and have given good results on a long term basis by bringing the cancer into a remission stage and giving a durable response, thereby prolonging the survival of the patients. This is especially true in an advanced and metastatic last stage cancers where there is only a glimmer of hope, and we have more options available right now. So as a result of this, cancer has now become more of a chronic disease, provided you take the treatment.
Okay, sir. So considering, you said that there are so many, there have been research trials are mostly focused on targeted therapies and, all of these novel therapies that can be disease. So, are there some successes in the fight against the disease, that you can recall at the moment, like any advancements in technology or any form of therapy at present, which has
Oh
proven effective
yes,
against
definitely.
uh,
I mean,
cancer? Yes.
if you see 3 4 years back, one of two important scientists from Japan and America have won the Nobel
Mm.
Prize, and because they discovered these immunotherapy, they were given the Nobel Prize for this. You see,
Mhm.
immunotherapy, targeted therapy, understanding the molecular signature of the cancers has been the recent highlight of cancers. By understanding the nature of this disease, we have been able to discover more treatment and targeting specific DNA mutations, as a result of which the cancer stops dividing and they get killed immediately. This is very true of the very nature of the cancer, that because of these reasons, more options have been now given to the patients. We are educating the patients that beyond chemotherapy, we have these options. You need to explore. We never know which particular um, uh, drug is going to help you on a longer run. These are the
Hmm.
important advances that we have seen in in this world.
Okay, sir. So, but also, in a lot of cases, you see, like people, they still get cancer despite following all the recommendations to reduce their risk. So, is cancer more of like an unpredictable condition as well?
Yeah, obviously, as I've told you that 30 to 50% of the cases you have some external triggering factors. But the remaining
Hmm.
50% you may never have any obvious reason why a particular person has developed a cancer. The reason for this is that the cancer is just not a disease of external factors, but also it is a disease of your internal body factors also. The rising age, the growing age itself is a risk factor. For example, if
Hmm.
a woman after the age of 40 is at an average risk of breast cancer, irrespective of any risk factors or any bad habits that she has it. All right.
Hmm.
So the growing age itself is a risk factor. Apart from this, if you have a strong family history and you may not have any other risk factors, you have an adequate lifestyle, you are regularly exercising, you are avoiding the obesity, yet you may develop these breast cancers for the only reason is because it's a strong hereditary predisposition in your family. The reason for this is that with rising age and a strong family history, the DNA code mutation changes, and this might give rise to tumors and ends up with your cancer.
Hmm.
So
Okay,
50%
sir.
it is in
So
our
that,
hands. The remaining 50% it is irreversible. We are not very sure, and that 50% will be there for everybody. But at least the remaining 50% is in our hands.
correct, sir. And also a very common myth I think a lot of us must have heard is that everyone has cancer cells and all they need is just to trigger. So, what is your take on this?
We do not have cancer cells in our normal body. We have normal cells, and these normal cells divides in a very controlled and regulated fashion. Any
Hmm.
external trigger or internal trigger that alters the genetic code or the mutations, then this division of these cells gets unregulated and starts dividing in an uncontrolled fashion. Then only we label it
Hmm.
as cancers. None of us in normal human body we do not have any cancer cells. So this myth has to be very clear.
Hmm. All right, sir. And as as you also work towards raising awareness in terms of cancer interception and intervention, early detection, as you said, it is possible to introduce these initiatives for better survivorship, for people of a high socioeconomic status, let's say. But how can you ensure the same for people of a lower socioeconomic status? Because not only do they not have access to good healthcare, but also they lack support and a medium of awareness. So how can this be done?
Yeah, this is important across all the various classes of the societies. Um,
Yes.
I mean, if it is difficult for the lower and the middle class societies to get access to all these screening programs, but I'm pretty confident that the government and many other organizations are actively playing role in reaching out to these people and getting you know campaigns for free cancer campaigns where there is a screening process going on for the common cancers like breast, cervix, lung, and immunization programs have been started which can prevent cancers. So I personally believe that uh, good initiative by the government and supported by various organizations and dedicated dedications by the specialists and doctors is going to help every class of society in diagnosing these cancers at an early stage by means of effective screening.
Okay, sir. Okay, sir. So this brings me to my last question for you, sir. In your experience as a doctor, when you diagnose people with cancer or when you have to break the news to them, have you seen them assume cancer to be a sort of death sentence, or do you think people tend to jump the gun and think that, okay, this is the end of the road for me, I'm pretty much, I would say, a dead person or whatever? So why is it important to not really internalize these assumptions? Because as you've been highlighting for the past, throughout the session, the large percentage of cancers are preventable. So why is it important that we do not internalize, cancer patients do not internalize these assumptions that, being diagnosed with cancer is as good as being served a death sentence?
I completely agree with you. I think most of the patients, when they come to me personally for consulting for further management, I can read their faces, their feelings, that they are sad. And the moment the word cancer has been diagnosed, they start thinking that this is possibly the end of my life, and that demotivates them a lot. Not even to the patient, but also the whole family members. So it's imperative and important that we continue to motivate these patients round the clock and show the positive aspects of the whole treatment. And based on that, a lot of motivation is being given, counseling is being given, and the positive aspects of treatment with illustrations and examples are being given, and this helps the family members in taking an appropriate decisions. Yes, there has been quite many a times that the patients, once they are being diagnosed with cancer and their last stage, a lot of patients also do not take treatment because they feel that it's in the last stage. But then we do offer them all the options. We tell them that these are the newer treatment options where good clinical remissions have been, have been achieved, and survival has also been prolonged. Based on all the various factors, the discussion goes on. It is important that they do not assume that cancer is equal to death sentence, because they get demotivated, they lose hope, and ultimately it does impact the overall treatment plan. At the same time, we do see some of the patients being superbly motivated, and they just want the doctor to be along with them, stand shoulder to shoulder, and fight along with this disease, which is equally important. So we see both types of patients, and we are also learning from our patients, and they also need us. So it's a quite an interesting scenario when we try to understand the human nature in terms of motivation in fighting against this dreadful disease.
True that, sir. So, thank you once again, sir, for joining us and providing a very lovely and detailed insight into cancers, preventing cancers, and of course, taking some things very seriously concerning your lifestyle. Not smoking, firstly, just to look cool, especially that. And I hope a lot of lessons are learned from watching this very interactive session that we had. So, once again, a very thank you to you for your time. And I hope that the viewers thoroughly enjoy this, find this informative. And we will see you next time with another session with another doctor. Until then, goodbye and stay
Thank you.
safe.
Thank you so much. Goodbye. Take
Thank
care.
you, sir. Good.